I'm Jason Korecki. I'm here today to present to you the Physician of the Year, Dr. Faisal Keen, my partner here with the FPG Hospitalist Group. When Dr. Wazin called me the other day to let me know that Faisal had been nominated for this award, my first immediate thought was that I couldn't agree with it anymore. It was obvious that he's been a standout physician since he's been here. And that he's really been extremely involved and really helped push pretty much every department in this hospital to be better since he came to us about 6 years ago. It then became pretty apparent to me that a lot of people don't know much about Faisal or about the impact he's really had in this hospital, because my second thought was I was surprised he didn't get this award sooner than this year. He came to us about 6 years ago from Buffalo, originally from Kashmir, and he was really different because he came in with an extremely hard work ethic, but he really wanted to get involved. And this was sort of a new thing for our hospitalist group, to really have more of this big picture, broad involvement, not just focused on the group or focused on your individual patients, but really focused on the whole hospital, the whole patient experience and patient care. So that was a big change for us, and I think that was really just the start of things. He really didn't have that much ties to the Sarasota area, but he came in and just committed 100%. He was all in, dedicated to Sarasota, to SMH, and you could tell from the beginning that he just really wanted to make the place better. He early on, when you first got here, he did win one of these Excel awards, and somebody asked me for a quote about him at the time, and my thought was that he had an impeccable moral compass, which is an odd thing, but I think that's really what stood out to me the most for him. Is he's not selfish. He doesn't do these things that he does for personal gain or for attention, but he really wanted the place to get better. He wanted the patient experience to get better, the patient care, the whole community effort to be as good as it could get, and he just used his brain power to kind of help make that happen. His individual patient care is phenomenal. He's if you've never met him, then you may not know this. If you know him, then you already know this. He's one of these people who's just a walking medical encyclopedia. But then he really, he takes all these details, this information, and when he applies it to the patients, he's applying it with an extreme amount of common sense and logic. And he applies it on an individual basis, not just, okay, my patients with this disease get X, Y, and Z. He's really applying it to the individual patient, their individual family situation. And it's really obvious, when you see those patients that he's cared for, that they're getting that personal treatment. He's extremely good at communicating with the families, communicating with the consultants, keeping the nurses informed. Everybody gets on the same page when Faisal's around. If he's on their unit for that day, it's all very organized. We're all together in the same page when he's involved, and that really stands out to me, seeing him as a colleague from that standpoint. An incredible worker. Hospitalists, we work about 15 shifts a month. Last week, Faisal worked 30 because we just needed it. It was busy. We've got this pandemic going on. Censuses are extremely high, and he's always going to be the first to jump in, help out. If it's very busy, there's extra patients, there's a bunch of admissions, he'll gladly take on extra work, never complain. He does it very willingly and happily. And then especially when things are stressful, he will, I'm sure, tell you that he enjoys that. You can see it, that he will rise to the occasion when you've got a crunch situation like a hurricane or like a pandemic or just crazy high census from seasonal influx. He's there, he's calm, he'll stay calm, he'll get in there and rise to the challenge. So he has that right kind of mentality, and the rest of the group certainly appreciates that calming, relaxing demeanor that he has during those times. Beyond his patient care and his work for the group, for our group, um, I don't really even know how much involvement he has in the hospital. I can't think of a department that he's really not involved. Heavily involved is an extreme understatement. I think he's developed a reputation as a very smart problem solver. He knows the hospital inside and out, and so at this point, I think he's kind of the guy in the hospital everybody's going to go to solve their problems, whether it's a new diabetes insulin management system, or heart failure order set, or new notes for the hospital, structured notes, to implementing the electronic prescription. All these kind of things seem to find their way to Faisal at some point, because we all know he's going to have some very good insights and very smart logic, and he's going to really give some contemplation on how to solve these kind of problems. So it all ultimately makes its way to Faisal, which is a good thing, because like I said, he's not doing things selfishly. He's really looking at that big picture. He's not going to put our group above the needs of some other group unless it makes sense for patient care and outcomes. So that's really been his biggest accomplishment, I think. Very few really see how much he does. I think nobody other than me and our office manager, because we just happen to be in the same office with him all day, every day. But particularly this year with the pandemic, he has definitely earned this Physician of the Year, no questions asked. I don't think anyone who knows him would have any hesitation to agree with it. And I certainly admire him a ton. I learn from him a ton. I get to work with him every day. And beyond all that stuff, he's just a really great guy with a good heart. The whole Korecki family, we love him. And we couldn't be happier that he's here receiving this award.
It has been an honor for me to be able to work at Sarasota Memorial Hospital. I came here, as Jason mentioned, around six and a half years ago, and from the very first day, I could feel that the place was different. Before that, I had worked in some hospitals in New York, done some observership in some hospitals in Washington State, but it felt to me that Sarasota Memorial Hospital is more like a family than a workplace atmosphere. And I have mentioned that to multiple people multiple times when I interview my new hospitalist applicants. That's what I tell them. When I interview my medical residents, that's what I tell them. When I work with my residents and other people, I tell them that they understand that they are lucky to be able to be part of the Sarasota Memorial family. At a personal level, I feel honored to be able to work here. I don't think everybody is able to appreciate the type of place they are working at. And sometimes, if you don't know, if you don't have any comparison, if you don't have any reference, you might not appreciate that. To be able to work here at the same time, to be able to get this Physician of the Year award, I'm really humble. I did not expect this. This was a good surprise. I do work hard, but at the same time, I understand and appreciate that a lot of other people work hard, and they are smarter and they're brighter, and they have much more impact on the patient care than myself. Having said that, I really want to be thankful to my hospitalist team. I think that they work extremely hard. I have their support all the time. We have been able to go through some difficult times in the last couple of years with our census and our patients and families not being in the hospital, and they have always kind of stood up and delivered. And sometimes there's a feeling that they might not be appreciated, but I want to make sure that they understand that all their work is really appreciated. Of course, I want to thank Jason. He has been with me for the last 6 years now since I joined, and he has always been on my right side, and we have kind of grown together, understood each other. And I believe that Jason deserves this award as much as anybody else would. He is hardworking. This is the only job he has done. He has been here for 11 or 12 years. He started this from residency. He is dedicated. He is honest. He has a great common sense. And I don't think that a lot of people know and understand that. My other office staff, Kristen, Kim, they work extremely hard, and sometimes it's not easy, and last few months have been much difficult, and Kim especially, she has been able to work twice as much and with a great smile. I want to make sure that I thank every other person who works at Sarasota Memorial Hospital, the nursing staff. They have been working so hard for the last year and a half. The respiratory team, I was on 10 Wally last few months, and I could see the amount of stress they go through on a day-to-day basis, and still being able to come back to that patient and being able to change the oxygen settings. They never said no, and that's very appreciated. Rest of the staff, the nutrition people, I could always see that how much stress they go through for just routine things when they have to get a order of a meal from a patient. They have to call them, and they don't know if the patient is able to pick the phone, and they don't know if the patient is able to understand them, and it should be all appreciated. And me and my group, we do appreciate all of that. The medical residents, I have been part of the residency team from the very beginning for the last four and a half years now, and I want to really thank all of them. They have been especially helpful in the last 2 months when we started this COVID hospitalist team on one of the units. Some of them really rose up to the occasion. Especially I want to name Dr. Zach Whiteside and Dr. Blake Studer. They were really kind of up to the challenge. They came, they worked sometimes 7 days a week, and they took care of very, very difficult patients, and every other resident as well. I want to also thank Michelle Shirey and Jack Rodman for trusting me with this job and supporting. They always have been helpful and supportive, and at times the things are challenging, but they have been extremely helpful. At the same time, every single person who works in the hospital, I believe that we have been through extremely difficult times, and as a group, as a system, as a cause, I believe that collectively we have passed. I believe that we could not have done any better than what we did, and that shows the strength and resilience of the system as well as the people who work for the system. Thank you very much.